Almost 700,000 people are affected with stroke each year. This is the leading cause of disability in the world. Stroke is the rapidly developing loss of brain functions due to a disturbance in the blood vessels supplying blood to the brain. In its simplest form, a stroke is a small clot in the brain which blocks blood flow to the brain itself. Depending on the location of this blood clot, certain aspects of a person's ability to function will be impaired. For example, a clot to the left brain will usually impair a person's language. If the clot is in the front of the brain, the person may be able to understand speech, but not speak. If the clot is in the back of the left brain, it may affect the ability to comprehend speech. Every physical sensation and emotion has a brain correlation, and each of these areas can be affected during a stroke. A right-sided stroke will usually paralyze the opposite side of the body. Right-sided strokes can cause impairment in a person's awareness of their own body, since the right side of the brain represents a sense of connection to the world around us. Stroke is a medical emergency, and it can cause permanent neurological damage, complications, and death if not promptly diagnosed and treated. Stroke is particularly common in Georgia, which is at the center of what we call the stroke belt. More people have strokes in the southeastern stroke belt than almost any other place in the world. Our advice to patients and their families is simple. If you think you are having a stroke, you need to alert someone immediately. Just like with choking victims, you may not be able to express yourself later. Report any loss of speech, vision, motor control, or loss of sensation to a friend or family member immediately. At the Neuroscience Research Institute, we've been a world leader in stroke research for over 10 years. We have enrolled hundreds of patients in clinical trials of the past 10 years. We have completed a trial for laser light therapy for stroke, which may provide the external energy source needed to keep a brain alive long enough for the body's protective systems to work. Despite these efforts, there is still only one drug on the market approved by the FDA to treat stroke, and there is a significant need to conduct more research into this condition. With this information as a background, you can understand why the Neuroscience Research Institute team of nurses and physicians want to pursue other treatment options. We are always seeking patients, friends, and family members to participate in this important research.